Hello, I am Lisa Obradovic and would like to welcome you to the podcast Certification Inspiration, produced by the Wound, Ostomy, and Continence Nursing Certification Board, otherwise known as WOCNCB. Founded in 1978, WOCNCB is a not-for-profit professional international nursing organization certifying over 9,000 registered nurses who are specialists in the field of wound, ostomy, continence, and foot care. We are launching the Certification Inspiration podcast with a series of episodes that will discuss the different roles of a WOCNCB certified nurse, nurses sharing their own experiences. In this episode, you will hear from Estrella Harrison, a certified wound ostomy continence nurse working at the University of California, San Diego in the Health Morris Cancer Center. Estrella, also known as STAR to patients and colleagues, has been a WOCNCB certified nurse for over 13 years. She will share a day in the life of a CWOCN in an oncology ostomy outpatient clinic.
Hello, my name is Estrella Harrison, known as Star, as a nickname to many staff and patient. I work in the University of California, San Diego, an outpatient ostomy clinic in an oncology center. I wanted to share with you how WOCN specialty certification has impacted and provided positive quality of life to meet the needs of ostomy patients in an oncology population. Our facilities serve 2 major hospitals with 2 WOCNCBs in each facility and multiple clinics in the community. I have been in the WOCNCB world for 13 years now. Right after nursing school, I began my work in critical care and trauma unit, where I worked for about 20 years. While I was an intensive care unit nurse, it was my passion to care for my patient's skin and chaired the committee for pressure ulcer prevention task force. One day, there was a job opening for a WOCN in this hospital. Our chief nurse executive offered me the position and paid for my WOCN schooling at Emory University. I am so grateful for that offer. Once I became certified in 2007, I worked as a WOCN-CB in a 125 beds hospital in acute care and rehabilitation center for 10 years. At times, I helped cover other WOCNs for their vacations in other 4 sister hospitals to gain more experience in other facilities. I love the autonomy and the various learning experiences they're just very rewarding. I have always wanted to see how a patient transition from acute care to home setting and how I can help my ostomy patient in the community. I transitioned to the outpatient clinic in 2018 in the University of California, San Diego Oncology Center when a job opportunity came along. In the past, the inpatient WOCN used to cover the outpatient clinic once a week for stoma marking until they can no longer keep up the demand. This has allowed the chief of colorectal surgery and administration see the need and the value of a WOCNCB with the increasing number of ostomy surgical diversion created yearly in the facility. This has given me another door of opportunity to learn how to start an outpatient clinic, being the very first WOCNCB in the oncology center in our community. So what is it like for a day in the oncology outpatient clinic? Due to advanced surgical techniques and initiatives such as robotic and laparoscopic procedure and ERAS, enhanced recovery after surgery, most surgical patients' hospital length of stay has decreased, and discharges are much sooner to home. So this means shorter time of inpatient post-op education. And my job as a WOCNCB in the outpatient clinic is to be available to patient in providing the continuation of education and resources for ostomy patients to live a full, confident life after surgery. Shortly post-op, they may be resuming chemo, radiation, or infusion therapy while learning how to care for their new ostomy. I prioritize seeing patients for stoma marking and pre-op education to prepare them for their surgery before they get so overwhelmed with their diagnosis. And then I try to see the patient 20 days post-discharge from the hospital to ensure they understand their survival skills, such as pouch emptying, changing appliance, managing the volume, consistency, and output. Patient tells me how much this has really decreased their fear of surgery, or to just see a familiar face as a support before and after surgery. So the other part is to make patient understand how frequently to change pouch, how to obtain supplies, or how to return to their previous lifestyle with quality of life. Majority of my consults are due to peristomal skin issues and lack of supplies. Most referrals come from colorectal, surgical, urology, trauma, OBGYN, GI, medical oncology. I am the only CWOCN for the outpatient, serving 2 clinics and the community. However, I work very closely with my inpatient colleagues. I work 10-hour shift daily for 4 days, and one of those days I focus in responding to patient call follow-ups, writing dural medical equipment prescription for ostomy supplies, and educating nurse case managers how to phone triage when patient calls to make an appropriate clinic referral to WOCNCB. I also receive multiple calls from home health and patients and nurses, since they also do not have access to a WOCNCB. So during COVID pandemic lockdown, many of our out-of-town patients or out-of-state can be overwhelmed and anxious to get help. Our outpatient clinic allowed me to do health video service as an option for wound ostomy patients or patient who is just too weak to drive to the clinic post-op. So my clinic day is usually a 60-minute block for each patient for initial visit and 30 minutes for follow-up. I have a medical assistant who takes my patient's vital signs and schedule, who arrives and schedules follow-up patients' appointments. My 60-minute clinic visit includes gathering history, troubleshooting, and usually I can check all their labs and everything through Epic, and then changing pouch and assessing main complaints such as peristomal skin issue and poor pouch fitting, post-op complications such as herniation, prolapses, and high output dehydration and complicated fistula management. So this really takes a lot of time, so I'm grateful for that 60 minutes. I provide each patient an after visit summary of all my recommendation and the plan of care and how to get their supplies. My goal for my patient is to prevent ED readmission. The top main concern are peristomal skin irritation and lack of supply and lifestyle inquiries such as returning to work. One of my patients is a nurse who had such difficulty pouching her urostomy with constant leakage due to her adhesive allergy, multiple skin creases and abdominal surgical scars from previous surgeries. It took several clinic visits to trial pouches from various manufacturers. I end up helping her mold a custom pouch with the help of a specialty manufacturer. Together, we were able to create her urostomy pouch with the correct fit. And after a year, she was able to return to work as a nurse again. And being a nurse myself, I was so motivated to research everything to help her to reach her goal and returning back to work. It was a very rewarding experience to be part of her recovery. And due to a high volume of patient phone calls and pager that is constantly beeping, I co-developed Ostomy 101 non-medical lifestyle class, partnering with a trained ostomy volunteer to provide tools for patients to live confidently after ostomy surgery. Many patients comment how helpful to get both perspective from clinicians and an ostomate. So a year ago, the ostomate volunteer and I also developed an Ostomy 101 app, a resources free for all ostomates to access. Everything they need to know about ostomy is all in one app. I believe that all ostomies should have access to resources and to WOCN, especially in the middle of the night when they have painful peristomal radiation dermatitis and just constantly leaking and just wanted to just review how to do crusting technique so they can heal their skin. So this app has been a valued tool for many of our patients. With the help of Ostomy 101 lifestyle class and the app, my phone calls have tremendously decreased, and this has provided me more time to see patients at clinics. So due to COVID-19, Ostomy 101 class is now currently being offered virtually via Zoom. I am so appreciative of UCSD Health Outpatient Clinic's Chief of Surgeon, clinical educator, and director, of who are all my mentors who saw the value of my WOCN-CB role. My patients voted me for the Daisy Award Extraordinary Nurse for 2020. This has continued to motivate me to make an impact and a difference in each of my patients' life as a WOCN-CB. So my goal is to help one patient at a time. It has been such a blessing to take this journey. And I want to thank you for listening to my story, and I hope this will inspire you to become board certified in wound, ostomy, and continence specialty. Thank you.
Thank you for listening. WOCN-CB sets the standard for wound, ostomy, continence, and foot care nursing certification by validating nurses' knowledge to provide safe, patient-centered care. Until next time, visit WOCNCB.org to learn more or contact WOCNCB at info@WOCNCB.org. And remember to follow us on social media. This podcast is produced by WOCNCB. Take care.